All right guys, so today we're going to talk about IAFM in the lower leg. One of the most common injuries in the lower leg is Achilles tendonitis. When using IAFM, we don't actually want to make contact with the Achilles tendon because there isn't that much vasculature in the area, and most of the adhesions, the fascial adhesions, are not actually located on the tendon itself. They're actually located in the muscle belly of that tendon. Most importantly, in the soleus muscle. Soleus and gastroc, but mostly the soleus. So let's just review the technique real quick. If we're dealing with chronic injury, we would be applying IAFM 2 to 3 times a week. And if we are simply trying to prevent an injury in the area, we would perform the technique more like once or twice a week. The stroke rate, how fast we stroke, is 180 strokes per minute. That's about 3 per second. And we only want to work on about 3 inches at a time, right? So we're not doing like these super long strokes. We also want to remember to stroke distal to proximal, or towards the heart. Remember, those superficial veins are located superficially and they have valves in them that help blood flow towards the heart. So if we're going away from the heart, there's a little bit of risk in maybe damaging some of those veins. So always go distal to proximal. And the angle, you're going to hold it to about 45 degrees. So if you're going that way, you're going to hold it 45 degrees this way. All right. Don't forget to apply emollient. We always apply a lubricant. Our emollient is made for IAFM. It's solid at room temperature and melts upon contact. It's also made with natural ingredients, and it fits nicely in our case here. So for treating the lower leg and the soleus, we're going to be using MEX, M-E-X, or medium convex. So that edge here on the ellipse is found right here. On the ergo, it's the one up here. And in the original, it's this one right here. Okay. You can also use Lex, the large convex edge. And if you want to get more specific, if you find like really a dense area of adhesions, you can use SEX here, small convex, which is this one right here on the original, this one on the ergo, and this one right here on the ellipse. It's also known as the tongue depressor. All of the anatomy you need to know to treat basically any part of the body is found in our anatomy guide here. It goes through every section of the body. It focuses on the anatomy that we need to focus on and anatomy that we should avoid. It also includes some post-treatment exercises. So let's jump right in and discuss some of the basic anatomy in the lower leg. All right, so let's start with anatomy to be careful around or to avoid in the lower leg. First off, we got the tibia, the shin bone here. Avoid that bony area, and the medial malleolus, that's bony area on the inside of the ankle. On the medial side of this, of the medial malleolus, remember there's the tibial nerve and tibial artery that run right around that medial malleolus. So, you know, try to stay away from the medial malleolus, and we don't really want to apply a lot of pressure directly on the Achilles tendon itself. On the lateral side and on the posterior side, so superficially just midline down the middle of the calf, there's a saphenous vein that you probably don't have to be super careful around, but just don't press really hard midline. That saphenous vein goes right down and lateral, and then we got the sural nerve that accompanies it, and then it whips around laterally around the lateral malleolus. So just avoid that lateral malleolus, that lateral bony area on your ankle, and don't get too close to it because that sural nerve wraps around it. So we're going to want to focus on the soleus. So the soleus muscle is this big calf muscle. The gastroc is the popular one. It's the one up here, but it really doesn't do that much in terms of moving or plantar flexion of the ankle. So soleus is right in here, and so this area down close to the Achilles, but not too far down, is where most of the fascial adhesions are located. And on the lateral side, it's the same thing. So we're going to go ahead and start by applying some emollient. And again, we're using MEX, this edge here. medium convex. We're going 45 degrees, distal to proximal. And one thing I forgot to mention was how many actual strokes you perform per session, and that is between 10 and 30. So we're gonna go ahead and apply 20 today at 180 strokes per minute. So here we go. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. And that was just that 3-inch area. So I can go a little bit more distal. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. There you go. And then a little more proximal. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. There we go. So I don't know if you can tell, but it's starting to turn a little red. Once it turns a little pinkish red, that's probably good. And so for me, I'm not dealing with a chronic injury or anything. I'm basically just trying to prevent. So I'll do this once a week. And so let's go ahead and do the same thing on the lateral side. And apply a little bit of emollient. And here we go. 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. You can see it's starting to turn a little red in this 3-inch area. And we're going to go a little more proximal here. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. I'm going to go over it with the Lex, large convex. I'm just going to do some. There we go. So that's pretty good for me. If you are predisposed to getting shin splints, that's inflammation of the tibialis muscles here on the front. You can do the same thing. I would also use MEX or SEX, the small convex, and just be careful with the shin, right? Be careful with your tibialis, with your tibia here. So I'm gonna go ahead and work on my tibialis anterior here a little bit. It's pretty good. 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. That's pretty good. Now, you want to be really careful around the head of the fibula right here. This is a very dangerous area. The common fibular nerve or peroneal nerve wraps around the head of the fibula. So it's on the neck of the fibula right here. You can feel this bony area. Just distal to that, there's that common fibular nerve. It's really sensitive. Be really careful around this area. You don't want to get close to this area at all. This is the outside of the leg, the lateral aspect of the leg. Be careful with that common peroneal nerve. So just stay away from here. Stay away from the bony areas. Focus more on the belly of the muscle. And there you go.